When I'm talking about the muscle rehabilitation, I'm usually thinking like the isometrics is like super safe because you're gradually building up pressure and you're not changing the length of the muscle. So this is the part 2 with the adductors strengthening or the rehabilitation program. In the part 1 we discussed quite a bit about what can be the reasons of the adductors getting a little bit irritated or not responding basically to our rehabilitation protocols with the loading and with the other factors. As with every other muscle or as every other problem, usually those muscles, we need to find the root cause or the main reason why that muscle group actually failed to respond. And it can be actually quite complicated. So this was just few basic ideas like what it can be. The goal of any rehabilitation should be, if there is any kind of movement or coordination issue, to resolve it, to maybe teach the person how to move a little bit more efficiently, so we are not loading, so we are spreading the load a little bit more over the body. Oftentimes just changing the pattern is not enough. Oftentimes it's a good idea to build up the strength and even use those exercises for a little bit of pain relief. So this brings me to the first category of the exercises, which are usually like super safe and they almost like benefit in 99% of cases regardless of the diagnosis, which is isometrics. So in order, like what to do with isometrics and adductors is kind of super simple. This can be done in a sitting position, on side lying, or on pretty much any other position where you can squeeze the knees together. So you can just get into sitting position and gradually just very gradually build up the pressure where you are squeezing the knees together. And again, like you can hold this for up to like 5 seconds, relax for a few seconds. What you can do is gradually build up the pressure or the tension, but respect your pain threshold. So if it starts to hurting, if you're initially maybe able to tolerate maybe like just half or 1 pound of the pressure, so be it. Over the next few days, more than likely you're going to build it up and you're going to be able to press way harder. The other part is the isometrics. What you're going to do is you're going to squeeze all of the blood from the tissues with the contraction and relax it when you are going to relax, and you're going to repeat it a few times, so it's going to have beautiful pain relief effect too. The most important is not to do too much too soon. So let's say I would just start with one simple set and maybe a few hours later repeat it. So you are not running into the risk of starting to do like half an hour or an hour of isometrics. I'm as guilty as charged. I want to fix everything in one visit, and then it gets quite irritated. So this was again just one of the options in the sitting position. You can definitely do the same thing when you're just lying down, and again just squeezing the knees, then just relaxing down, squeezing, holding for 5 seconds, relaxing. In this, you can, with all of the isometric, you can start paying attention of how your pelvis and your rib cage is aligned. So if you are overextended, you can just bring it down, make sure that everything is aligned. If you are familiar with intra-abdominal pressure, it will help to create a little bit of extra activation of the obliques. So when you are squeezing, it's not just going to be the role of the adductors. From the objects you can squeeze, it can be something firm like a yoga block, it can be a book, it can be even your own fist. Or it can be some kind of ball, which is going to give you a little bit of that feedback that you kind of feel how much you are squeezing, and it's going to give you a little bit of the tactile feedback. So it's the matter of preference, to be honest. So none of these is better or worse. When I'm talking about the muscle rehabilitation, I'm usually thinking like the isometrics is like super safe because you're gradually building up pressure and you are not changing the length of the muscle. The next thing would be to use kind of concentric variation. So what you can imagine with the concentric is lifting things up or lifting the leg up. How would you do this with the adductors? Is like, it's pretty simple. You could actually stay in the what is called like a low oblique sit. So in this position, you just place the top leg a little bit in the front of bottom one, and then you can just use this for like a little bit of support, and you can be just lifting the leg up just like this. Again, just making sure that the trunk is nice and stable. Usually the compensation would be almost like you would be doing a little bit of this, so letting your body go into the banana shape. So again, just lifting the straight leg and just pretty much doing it like this. if we are talking about short adductors, the function can be from the hip flexion, could be just lifting it like this. So again, like you are keeping your pelvis nice and stable, and you are almost like doing something like a reverse climb. And the last of the contractions, so we have the isometric, we have the concentric, and then we have the eccentric, where we are basically lengthening that muscle under certain load. My preference, if I can do eccentrics, I usually try to do them in the closed chain. So one of those options is in the side lying position. You would basically rotate your pelvis in regards to your stable femur. I will show you basically what I'm talking about. So you can use the same yoga block for a little bit of head support. Then you would just lie down in this kind of side lying position. Again, like just checking for the trunk position, keeping everything nice and stable. You can put something, or you can just put your arm a little bit under the knee just to give it a little bit of support, and then you're just going to be rotating your pelvis in and out, in and out. So what this exercise does is, if you can imagine, like your attachment for your adductors is on the femur, on the bone over here, and it attaches on the pelvis. So now those muscles have to kind of control and decelerate, so slow down the movement backwards. So they have to lengthen and contract at the same time, otherwise it will just flip like this. And again, you are slowly building up the repetitions like this. You can use the yoga block for a little bit of head support, so your neck doesn't get tired. Usually the common mistake is just to let, almost like there is not much dissociation, or people are not able to move the pelvis independently to the leg. So this usually helps to bring up that motion. Perfect. So this is end of the part 2. This was super basic protocol of when I'm starting to work with a patient with the adductor strain. This could be one of the options I'm choosing when I'm starting to retrain the ability of your body to produce some force through the adductors. It doesn't mean I'm going to fix the issue like this, but this is usually going to bring a lot of blood flow, a lot of control, and a little bit more confidence for the people to contract to use the adductors. None of these, maybe except the last one, the eccentric exercise, it's very functional, but this can be like nice introduction for the later stages where we are loading those adductors and the hip complex a little bit more in the pattern, like when we are lunging to the side or reaching or jumping, stabilizing, doing other things. But that's definitely for later. Okay guys, thanks very much for attention. In those next videos, I'm going to go over how to use the low oblique sit and load it a little bit more in the functional pattern into all 3 planes. So we are going to be using those adductors to stabilize the pelvis and then move the pelvis kind of in and out in all planes, and how to load it isometrically and how to progress it. So like super simple progression, something what I wish more people would use, because what I oftentimes see is a lot of people jump almost like too quickly to the Copenhagen adductor exercise, which is like very high level progression. And also that progression or that exercise also targets the adductors in not very natural plane. So yeah, anyway, that's end of the rant. Okay guys, be good and talk to you soon.